Hi, good morning. Welcome to Healthyho. I am Dr. Swarupa here from Rajiv Gandhi Cancer Institute, and today I am going to discuss about a topic which is very important to all of us and a topic which we are all related to, that is anemia. Anemia, especially when women and girls, and that is adolescents. So before talking about anemia, let me first explain what anemia is. Anemia is less of red bloods. Very simple to understand, that less of red blood cells in the body. Now why is it so important? When we have less of red blood cells in the body, the hemoglobin content is less, and as we all know, hemoglobin is the carrier which carries oxygen from the lungs to different parts of our body, different tissues and different organs. So when the hemoglobin is less, or when the red blood cell content is less, then this oxygen carrying capacity decreases. So all the tissues and the organs get less amount of oxygen than they require. So the result is there is a deficiency in oxygen, and that makes the person weak, and that has effect in different parts of the body. How common is anemia? You'll be startled to know anemia is very, very common. Even today, when we are all so evolved, when we are developing or becoming a developed nation, the number of anemia cases are probably the largest in India among all developing countries. Now, according to recent data, more than 50% of the population, be it men or women, are suffering from anemia, being diagnosed or without being diagnosed. Out of these, number of children suffering from anemia are about 58.34%. This is a very recent data. And what about women? Now women, they can be categorized as pregnant and non-pregnant. Why? That I'll tell you in my later in my speech. Now, the pregnant women, it is more than 50%. They constitute more than 50% of the women who are suffering from anemia, and about 53% of the non-pregnant women who are suffering from anemia. This much is the burden of anemia in our country. So what is the cause? What is the cause? Why is it happening so much? There are lots of causes actually, and more than we can decipher or more than we can understand. The first and foremost is, as we all can understand, is the socioeconomic status, which leads the way to a bad and poor nutrition and poor health. So that is the crux why we develop anemia. Poor nutrition means we all have food, our daily nutrition, but it is probably not rich in the constituents or in the vitamins or in the minerals which are required in the body to have a proper red blood cell or hemoglobin. That is lacking. So although we have our calorie content probably okay or good, but it is not sufficient for us to not to develop anemia. So nutrition is very, very important. It is linked to poverty, because when the per capita income or probably the per family income is less, then a less amount of money goes to getting a good quality of food. Second is the health. Poor nutrition does give rise to poor health. So poor health means low weight, and it gives weakness, it gives all other symptoms. It also affects the working capacity, and also later on it gives rise to many infections, decreased immunity, and then it causes to death also. It may affect the other organs of the body. So how important that nutrition is in our life, that you can understand. The second is hygiene, which is the more we stress is probably less. Hygiene can be a sanitary hygiene, it can be a menstrual hygiene. So both of these are very important. Now that also happens, we adopt in our life when we have the awareness. So the lack of awareness is another factor which we need to develop to battle or to curb anemia in our life. The fourth important factor is, which I would collectively call as a social factor. So there are many factors again in this social factor. The first and foremost is the education. Women education is a must, and this is actually seen in different studies that women who are educated, they have healthier children, and because that gives rise to awareness. So women education is a must if we want to battle anemia. Second is number of children, early marriages. These are factors which probably affect the lower socioeconomic status, but we do see these traditions in the upper strata also. So I would categorize them very important, because indirectly when a woman gets married earlier, then her education suffers, and as a result she goes into the family wheel and she does not look after self. And that brings me to another very important point, that is the Indian tradition. The Indian tradition is not women friendly, and I would say that the women themselves do not look after themselves. So in a family, when you go into a family, we see that the women, they are the last people to eat. In fact, women take pride in saying that I am the last person to eat and I eat all the leftovers. So this is not something which we should be proud about. This has to be, and I think the onus lies in the rest of the family members. They should see that the women get the proper nutrition. So these were in brief about the causes, what gives rise to anemia. Now, how do we fight it? Or before coming to the how do we fight, I think I would say, what are the effects? The effects are long running. Now, we might say that a woman is suffering from anemia, but actually it is a total a full chain, because it is actually anemia is probably develops in the fetus, that is in the womb, and that it grows throughout her adolescence, her girlhood, and then it aggravates when she is in pregnancy, and it is throughout life. So we need to break this chain. So I think the first step where we start in is the pregnant women. The pregnant women, they need to look after ourselves. Why this is so? Because when a pregnant woman, she suffers from anemia, she suffers from less of oxygen, she passes this on to her fetus. As a result, the fetus has a lesser neuronal development, CNS development. He develops a mental retardation later on, a retardation in physical growth and also the mental growth. And most importantly, there is a deficiency in his iron content of the body. And this is very difficult to overcome even when she grows into adulthood. So the first step to stop anemia is the pregnant mothers. They should be taught to eat good food, to take proper rest, to include all the nutrients that are required in their diet. Other than this, later on when a child grows, the anemia causes retardation in his physical growth, in his mental capacity, in her power to concentrate in her studies, in her learning capabilities. So these are the effects which we see in adolescent girls or growing girls, for that matter, even in boys also. Later on, this affects when the child grows into an adult woman. Again, she bears children and she passes this on to her next generation or the fetus in her womb. So it is a very vicious cycle, and no part, in fact, no woman, either she is a child or an elderly woman, can be said that she does not need a protection from anemia. Anemia needs to be curbed in all stages of life. Now, how do we do it? The first and foremost is the nutrition. Nothing is more important than nutrition. One should be taught to eat good food. That good food means more of nutrients. Legumes should be added in the diet, non-veg, green leafy vegetables. All these things should be added in the diet. And one thing is more important, it's not only when you may think that when you have all the nutrients in your body, you are fine. No, there are worm infestations and there are infections which might trouble a woman. So that is why the infections also need to be treated. Deworming should be done for all children. So these are the areas where we need to focus on if we want to decrease anemia from our lives. Other things are a good lifestyle, a good health, good hygiene, a sanitary hygiene should be promoted, menstrual hygiene, where there should be awareness of how to improve the hygiene of the menstruating women. So these are basically the facts which we should know and which we should incorporate in our lives if we want anemia to stay away from our lives. Thank you very much.